During this video, we will tell you all about medical interventions during World War II.
Hey.
Where?
I got shot in the leg. Help me. It hurts. It hurts. Oh.
Morphine is a pain-killing drug first isolated by Friedrich Turner in 1804. It was discovered as the first active alkaloid extracted from the opium poppy plant. Because morphine, like other opiates, is so addictive, many soldiers suffered from morphine addictions after the war. Not knowing what it was at the time, this addiction was often referred to as soldier's disease. A way for medics to administer this painkiller on the front lines was developed by a pharmaceutical company called Squibb. They introduced the morphine syringe, which was like a miniature toothpaste tube containing morphine. A needle could be attached to one side, and this is how medics could inject wounded soldiers efficiently. Its effects, however, lasted only for about an hour. Inside the medical theaters during World War II, few measures could be taken to prevent disease. Mainly, sterilization of tools and thorough cleaning of bandages were the precautionary measures taken by nurses, doctors, and surgeons. A Thomas splint like this one was invented by Hugh Owens Thomas in 1875. It was a critical piece of medical equipment used on severe and complicated leg wounds in World War II. This treatment first involved immobilization of the limb, typically in an attempt to begin healing a fractured femur or thigh bone. The injury often occurred from being shot in the upper leg. If not treated immediately, injuries such as these could become infected, or bone fragments could cause internal damage to nerves and blood vessels. These second-hand effects could lead to paralysis or death. The Thomas splint allowed medics to quickly immobilize the wounded leg, thus drastically improving the soldier's chances for a full recovery. After the splint was secure, a 4 to 5 inch plaster cast was applied. This treatment, called a Paris cast, was intended to keep infections out of the wound until the patient could go into surgery. If gangrene set in, the soldier would need an amputation. This system was set up to avoid as many amputations as possible. The Paris cast, along with penicillin, was very effective in preventing soldiers' wounds to become infected. This is the era surrounding the discovery of penicillin. In the war, this antibiotic was used to treat infections such as gangrene, pneumonia, and gonorrhea. In 1945, a penicillin was created that was 20 times more potent than the one developed in 1939. Penicillin can be taken by mouth or an injection. This drug became used generally and was given to any who were sick and in need of healing. Eventually, the mass production and overuse of this antibiotic caused penicillin to lose its effectiveness. As well as leg injuries, arm injuries were common in World War II. As you just witnessed, an explosion occurred on the battlefield, inflicting a deep arm wound on the soldier. It's clear that he will need stitches. After closer inspection, it appears that he has a median nerve damage. Because no nylon thread is available for the procedure, this theater nurse uses a strand of her hair to sew up the open wound.